Welcome, everybody. We will be providing interpretation at today's session. I'll be making this announcement in English and Spanish. Bienvenidos y bienvenidas. Proporcionaremos interpretación en la sesión de hoy y anunciaré el mensaje tanto en inglés como español. We do invite everybody to please select English if you're monolingual English speaking, and in this way you'll be able to hear the interpreters go from Spanish to English if folks make a comment in Spanish. Presenters, please remember to speak at a moderate pace because we do use 30% more words in Spanish. If you're on your computer, at the bottom of your screen, you'll see a globe and it says interpretation. Put a check mark on your preferred language. If you're on your cell phone or tablet, locate the three dots, tap it lightly, and put a check mark on your preferred language, and be sure to click done to activate the interpretation. Friendly reminder, if you see the interpreter raise her virtual hand on Zoom, make sure to speak more slowly. Les invitamos a todos a que seleccionen el español si está limitado en su dominio del inglés. De esta manera, puede escuchar a los intérpretes del inglés al español. Si está en su computadora, hay un globo terráqueo en la parte inferior a mano derecha de la pantalla que dice interpretación, donde podrá seleccionar español. Selecciónelo al poner una palomita. Si está usando su celular o tableta, ubique y toque los tres puntitos ligeramente y ponga una palomita en español. Seleccione Done o Finalizar. Este último paso es muy importante para activar la interpretación. Gracias. Thank you.
Hi, everybody. Thank you all so much for joining us today. My name is Catherine Riley. I use she, her, and ella pronouns, and I'll be facilitating today. I am the Policy Director at the Colorado Organization for Latina Opportunity and Reproductive Rights. We are a community-rooted, Latina-led reproductive justice organization that works to enable Latinas in our state to lead safe, healthy, and self-determined lives. And this year, we are proud to be celebrating our 25th anniversary. I hope you've all enjoyed the last couple of days of the convening and are thinking about building power for health justice in new and exciting ways. We are so excited that you all are joining us for this last plenary, where we will be talking specifically about community power, what it means to our panelists, how they're building it in their communities, and how we make sure that we're actually shifting power to the people without being transactional or extractive. I am so honored to be facilitating this conversation with such an incredible group of advocates. I've been able to learn about their work over the course of preparing for this talk, and I continue to be inspired. First, we'll be joined by Layla Ali, co-founder of Muslim Women For. In speaking about their work in organizing, storytelling, and reproductive justice, Layla described the organization as forcefully emerging within the North Carolina community that they serve, and I couldn't agree more. Next, we have Erica Andrade, who has been serving her community in her role at El Centro for 22 years. Their work spans everything from education to economic empowerment to healthcare access and advocacy. The trust they've built within community is clear as they celebrate their 45th anniversary this year. Margaretha Bledsoe is joining us from Georgia, where she and her team serve as a model to the rest of the country on what federally qualified health centers can and should be. She said their work at the Family Health Centers of Georgia is a catalyst for education and connection. And last, but certainly not least, is Parisa Charmchi Goodwin. Following a long career in various policy areas, including oral health and substance misuse, it makes sense that Parisa is now leading the state's Commission on Racial Equity and Public Health, which was created after Connecticut's declaration that racism is, in fact, a public health emergency. Before we dive into hearing from our panelists, there are a few things to mention. We are going to save time at the end for questions. We're hoping for about 10 to 15 minutes or so, but you can also drop any questions you have in the chat, and myself or the panelists will do our best to answer them. But we definitely want to hear from you, so please don't be shy. And now we're going to get started. So to start, I'm going to ask each panelist please to introduce themselves and to tell us in one word what community power means to you. And I'll first start with Layla.
Thank you so much, Catherine. Hi, everyone. It's so good to be here. So grateful for this space. My name is Layla Ali. I use she, her pronouns. I'm one of the co-directors and co-founders of Muslim Women For, which is an organization that we started as student organizers 7 years ago on our college campus, following the Chapel Hill shootings in North Carolina. That took the life away from 3 members of our community who are Muslim, an Arab, and also as the presidential elections were unfolding in 2016, and we were seeing intensified anti-Muslim rhetoric, especially around Muslim women. And now, 7 years later, we are working to build local and grassroots power across North Carolina and build political power in Muslim communities. And I think that the word that really comes to mind today for me when I think about community power is safety.
Erica?
Hi, everybody. So glad to be here with you today. Erica Andrade, President and CEO of El Centro. I was newly appointed to this role just in July, but I'm not new to the organization. I have been with El Centro for 22 years. I've had the pleasure of working for this amazing organization. It is a Latino-led, Latino-serving organization. We consider ourselves a Spanish-first organization, which means to us that everything that we do, from education to outreach to programming to services and the communication, is all done in Spanish first. And then sometimes it's translated into English, but really not all the time, as some of our services and activities are just in Spanish. We serve primarily the Latino community, Spanish-speaking community of Wyandotte and Johnson County here in the state of Kansas. We've existed for now 46 years. And as our founder, says proudly, El Centro was created to combat racism in our community when a lot of Latino immigrants were immigrating into the area, working on the railroad, the Pacific Railroad. There wasn't any services or any way to give them access to the things that they needed in their communities because nobody was equipped linguistically or culturally to serve them. And so that's when El Centro was created. And so we continue to do that. We're a welcoming center for Latino families, is what we call ourselves. And I love working in an organization where we treat language and culture as a direct extension of everything that we do internally and externally to our communities. We do everything from early childhood education with a dual language preschool to community health programming to emergency assistance and job training and homebuyer education, and then advocacy as well, with promoting individuals get civically engaged in their communities regardless if they're voters or not, because just because somebody can't vote doesn't mean that they don't have a voice and a story that they need to tell. And so, yeah, that's who we are. And in one word, what does community power mean to me? I would say potential. Thank you.
I'll go next. Hello, everyone. I'm Margarita Bledsoe. I serve as the Director of Marketing for the Family Health Centers of Georgia. We are a federally qualified health center that has existed since 1975. And our purpose and mission is to make sure that underserved communities have access to healthcare and to see healthcare as a right and not a privilege based upon your economic status or your racial or your gender identification or your sexual orientation. So we cross-reference all health services, primary healthcare services, connection to specialists. And in addition to the role that I serve for the Family Health Centers of Georgia, I also serve as the Director of Marketing for the Georgia Family Planning System, which is a program that is administered by the Family Health Centers of Georgia. In that program, we operate or oversee 183 sites throughout Georgia that makes sure that women, teens, and males' reproductive rights are protected, that they do have access to healthcare and quality counseling for whatever decisions that they might be making towards their planning, their families. And that is an extremely important role in the environment that we're in here in Georgia. In one word, for me to sum up what I think community power is a result of the previous role that I had prior to joining the Family Health Centers. I served as the First Lady for a metropolitan city in Georgia that had elected the first African-American mayor for that city. And in that role, I had a firsthand opportunity to see how community voices are not heard across all spectrums, and a firsthand opportunity to see how many policies and procedures and decisions are being made without everyone at the table. So the word for me is independence. People having their independent stance at the table and not feeling coerced by anyone else's decision, but being independent in what is important to you.
That was beautiful, tough to follow. My name is Parisa Charmshi Goodwin. I use she, her pronouns, and I am the inaugural executive director of the Commission on Racial Equity and Public Health for the state of Connecticut. As Catherine stated, this commission was created actually during the pandemic and shortly after the murder of George Floyd. There was a lot of conversation and movement in the state to declare racism as a public health crisis and also dedicate a state agency to act on it and to be an accountability measure for the state. So we're housed within the legislative branch. Our main duties are data reporting on health inequities and the social drivers of health, including things like housing, food insecurity, criminal justice involvement, education outcomes. And then we have a duty to engage community in the work that we do, including our study and understanding of health inequities and the changes that need to be made to rectify those inequities. And then our main function is policy analysis and recommendations. So we make policy recommendations that, if enacted and implemented, would decrease the impact of racism on public health. So always reminding people and noting that whenever we're talking about health disparities, disparity means a difference. And when we're talking about disparities on the basis of race, those are inequities. Those are due to social injustices. Those are due to policies and decisions that were made, which means that policies and decisions need to be made to right that course, right? To narrow those inequities that we see. So that's what we do. We are new. We are about a year old as far as being staffed up. So we're still in our visioning phase, but also active in the recommendation making space, because we do feel a sense of urgency.
Thank you, Parisa.
My one word. My one word. If I had to choose one word, I would choose change. Thank you.
I love that. Thank you all so much. When we were preparing for this panel, all of the panelists said that community and participant engagement is really important. So if you feel moved, please go ahead and you can put your one word in the chat as well. Okay, so diving in now to our actual questions. And Erica, I want to start with you, please. Our first question is, where are you seeing cross-movement collaboration and power building? And what are some of the impacts of that work?
Sure. Here locally, I could say that some of that cross movement collaboration and power building is happening a lot through our foundations, our local foundations, our healthcare foundations. So we have Health Forward Foundation and the Reach Healthcare Foundation, and they've been very adamant about having these difficult conversations and moving to a trust-based philanthropy and working with the fundies that they've been partners with to have these conversations about how they can make the work that they do more equitable and more in tune with what's going on in our communities. And I think that's really great because they do have a lot of influence here in our area. But it's not just there. We've also seen it in the coalitions that were built during the pandemic to address those issues that the government was not addressing. That basically taught both local municipalities and local governments that those collaborations are key to making things work in our state. And so that's, CBOs, community advocacy groups, faith-based organizations, sometimes unlikely players that are now all working together to get things done in our community to improve our community. We've really seen that take off. And now as a pandemic is kind of winding down as far as funding and things like that, I think the power and the strength that we showed united, that part isn't going away, because one of our coalitions was the Health Equity Task Force that was created as a partnership with our Unified Government Health Department and then CBOs and faith-based organizations. You know, at this point, we're having those conversations of what's next. How do we continue to do the work that we were doing to address the pandemic, but now in those other health equity issues that are so important and that they're not go away. They were there before the pandemic. They were highlighted by the pandemic. And so now we just can't stop with it. So I think that's really great that everybody was able to kind of acknowledge and understand the power that happens and how change can truly happen when you collaborate together.
And for the other panelists, please feel free to jump in as you wish.
Yeah, I can share. I guess I'll start by saying that I really believe that we have a strong ecosystem of cross-movement work in North Carolina that has been building for decades, and I'm really hopeful for the shifts and moments of real strategy that has been built over the years that in which we have seen like a lot of powerful progress happen across the state. You know, this year North Carolina became the 40th state to expand Medicaid, which would benefit over 600,000 North Carolinians, and this really was the result of years of building power and leveraging resources through cross-community solidarity building. You know, folks were organizing visuals and teach-ins, and they took the streets and they led strong advocacy fights inside the building and outside the building. And honestly, you know, the fight continues, right, to push for more racial justice and immigrant rights agendas as we think about health access and policy. And I think another exciting collaboration that we are a part of, that Muslim Women For is a part of, is really building out a North Carolina Repro Freedom Coalition. So we've come together in various moments through the years to do legislative accountability work and political education efforts, but this was really the first year where we initiated infrastructure to land on values and objectives as a coalition, right? We talked about who are our people, you know, who are we centering? What does progress and liberation mean to us? And this year, we co-organized several lobby days against a 12-week abortion ban that brought together over 200 people multiple times from across the state. It was interfaith, it was multicultural, it was intergenerational. You know, and unfortunately, the 12-week abortion ban that we were fighting passed in our state because, you know, the makeup that we are dealing with in our state legislature. But what I can say that we've been able to accomplish is that we built a large base of advocates who we will mobilize next year and the year after that to elect people out that did not stand with us. And this year was really the first time that Muslim Women For recruited and trained Muslim advocates from across the state, mostly working people, young people, and women who attended the lobby days and felt empowered to be in our state legislature. Y'all, we know that these spaces are not welcoming to us. You know, they don't always feel safe for our people, and we had to disrupt that. So that's where we landed, and I'm really hopeful for this emerging space that's coming together, that is centering Black and brown people, trans people, people of faith who have been racialized in many ways. So yeah, a little bit of what that has looked like in North Carolina.
I would like to speak to, I apologize. I like to speak to two projects that I think are important for Georgia. Both of them have a national connection, and the opportunity to implement them in Georgia was very important. One is through the National Association for Community Health Centers, is an advocacy program. And that advocacy program is designed to teach doctors who are trusted voices how to communicate with your patients about the importance of them registering to vote and knowing who their elected officials are, and also to teach patients how to speak to your legislative body. What's the process? Given the templates and the tools for being able to send the emails and make the phone calls, and just empowering our patient base in our community as a whole, that you do have a political voice. And so I think that's very important work. The second thing that I speak to is what we're doing under the Georgia Family Planning System program, where we brought together a coalition of fairly qualified community health centers in addition to other healthcare providers. And we're saying that people have the right to know what their choices are with their own bodies. Georgia passed the ban at a 6-week mark for abortions, which really leaves our people of color, our African American and Latino families, women struggling for what their solutions are going to be, and struggling to get information and struggling to feel safe. We do not want to go back into the days of women doing self-inflicted healthcare practices that are not safe. We all, we've heard stories about clothes hangers and drinking poison and many things that women did over the course of years when they did not want to fulfill a pregnancy. And so we don't want to be in a position now where women go back to desperate measures. And we know that so many availability of information and access to the services can be hindered based upon your economic status. And so we are already dealing in a racially motivated environment where people are economically disadvantaged, then they're also going to be disadvantaged in their healthcare access. So our network of providers are available to provide people with safe information about their family planning choices. So those two things I think are great works in our communities.
Yeah, that was beautiful. Thank you for sharing that really tangible example. I just wanted to, as I was listening to everyone, I was reflecting on the fact that like this work needs to happen in coalition. And so hearing the different ways advocates really kind of hold us down and keep us moving forward. And advocacy looks different, right? So seeing like grassroots things amongst people where there's genuine friendships and there's trust, and you really build community with another, and then even expanding and working across difference or working interprofessionally, and the role that legal aid attorneys and providers and faith leaders and all these different groups, which can also have genuine relationships too, right? But how that's so necessary, I think, to sustain this work and to make it possible. And as someone who spent more time in kind of in the advocacy realm and is more newly a government employee, I think those kinds of connections can be important too, right? That advocacy might look different, but there's advocates here at heart because you have to believe in this type of work to really stay in it and for this to be your focus. So hoping that we can kind of bridge through from community to policymakers as well.
Thank you all so much. I'm just so excited to hear from folks who are in states where, the will of the people does not really match your legislature. And so it really is about building community power and that organizing work, and just doing the long game is really, I think, what it is. But it's super exciting. And I think in Colorado, we're pretty lucky. We do have a legislature that sides with us a lot, but what we've done that's been really successful is similar to this. Like, we take our reproductive justice work into other spaces, and we talk to the immigrant rights folks, we talk to the labor people, we talk to the health equity people. And so it's now the time to bring everybody into our movements. We can't be siloed anymore. So moving to the next question, I think that we can all agree, unfortunately, that we are in very intense and troubling times. Many of our communities are facing horrific and terrible things, and it often feels like our government is working against us instead of with or for us. Can you please tell us about the impacts you might be seeing in your community from coordinated political attacks and the dismantling of democratic systems? And as well, how you might be thinking about or preparing for more impacts to health justice. And Layla, if you want to start with this one.
Sure. Thank you so much for this question. I think it's a really good question, and I think very timely within the context of what my community specifically is experiencing at the moment as it relates to the attacks that we are all witnessing on Gaza, and what we are preparing for as we see intensified anti-Muslim rhetoric specifically. And to just draw a larger picture here, to zoom out a little bit, across the country and especially in the South, we are witnessing an increased militarization of our local and state governments, right? You know, I think a lot about Cop City in Atlanta, for example, in that struggle, which is by design created to suppress our movements and strip our access to democracy. And in the backdrop of that, we've seen dozens of anti-protest legislation either being proposed or passed through our state legislature, which again are designed to disrupt our abilities as coalitions to lead and succeed in orienting movement and community-rooted advocacy and policy efforts. And so I think this is really important to just keep in mind as we talk about health justice and navigate the ways our communities will be criminalized for just existing in their own bodies and identities and their access to care. And to capture what we are preparing for as Muslims and BAMEMSA communities in this moment is the rolling back and continuation of what the systems and the mechanisms that we saw post 9/11. So the surveillance mechanisms that deeply targeted our people and their access to not just care, but literally safety. I think about CVE, for example, which was a program that was set up, which is a counter-violent extremism program that was set up as a strategy that recruits community leaders, social workers, teachers, and public health providers to essentially assist the government in identifying people that they thought would be at risk of becoming violent extremists. But what this actually did was target exclusively Muslims, and it was used to repress other marginalized communities, including Black activists, LGBT communities, immigrants, refugees, and young people. And when it comes to healthcare, we saw a distrust between providers and patients, you know, because providers were literally encouraged and asked to report who they thought would be at risk of terrorist activities with no real guidance. And many of these people were undocumented and refugees and people navigating second language barriers who weren't able to communicate their advocacy, or working class people who were already vulnerable. And we also saw a rise in gender-based violence that primarily targeted visible Muslim women. And so that is, I think, the true context in which we're operating under. And we're really responding to this by honestly trying to think about building our own systems of care and protection for our people, you know, putting together networks of training and support for young people and student activists, trying to figure out how can we best support Muslim women in our community that are worried for their children, are worried for themselves, like scared to go to the park, you know, do just regular things that we all want to do. So I hope that is, you know, this is not an exhaustive, obviously, a list of ways that this is showing up in all of our communities, but I hope that that's a good capturing of what we are particularly are experiencing at the moment.
I really appreciate that. Thanks for sharing. I think I come from Kansas. You know, unfortunately, Kansas is still one of those states that has not expanded Medicaid, one of the last few. And so that goes to talk about how there's a really big disconnect between our legislative and the people's will in the state of Kansas. And we've seen it in multiple things with our current Secretary of State, who's extremely anti-immigrant, has made those views very, very clear. And now seeing the impacts of that as we have just passed HB 2350 here. It came into effect, that law, on July 1st. It was touted kind of like a trafficking law, which of course nobody's for human trafficking, but it really is an anti-immigrant law, is what it was meant to do. And it has caused a lot of fear with our communities. And so having to kind of fight against those policies and explain to our community leaders and those entities, the department entities in each community, how this actually hurts our community by building fear. And not saying that anybody's about, you know, for human trafficking, but that was never the purpose, because it was written vaguely. And so seeing how the repercussion of that law has now taken an effect into services in our communities that affect our communities. For example, the county that I'm from, Wyandotte County, had just passed, because of a lot of grassroots advocacy work, a safe and welcome policy initiative, where there was part of it included municipal IDs for anybody, unhoused, undocumented, anybody really. But they put that kind of program on hold because of this law and this fear that somehow there would be repercussions. We had also received a grant through ARPA funding to do legal aid for undocumented folks here in the county, because Wyandotte County has a large percentage of Latinos, and some of those are undocumented folks that don't have this kind of like resources. That was put on hold because of this law. So so it's how these policies and these laws that affect communities individually that hurt their people instead of helping for what they're supposed to be intended. And so we see this a lot. We saw it last year when they tried to ban abortion in Kansas, and thankfully the people prevailed in that case, and we were able to protect women's rights, which I think a lot of people were very shocked about because it's Kansas and it is a very Republican conservative state. But young folks, women, everybody kind of rallied together and said, no, not in our state, kind of thing. And so we know that we have the power. When you build power like that, we know that there can be a change, or we can affect change. The problem is keeping people motivated and engaged, not just in those kind of instances, but then really looking at who's running for these positions that then, when giving the power, are creating these laws that are hurting. So although we were able to hold off on and protect women's rights, we allowed other people to get elected because they didn't come back for the general elections, who are now creating these laws that are anti-LGBT, anti-trans, anti-immigrant, so that it still hurt people. So it's kind of really frustrating because you get some wins, but then you see how, when you're not really paying attention to the big picture, it can easily kind of turn back around and hurt the communities which we're trying to serve.
Margaretha, do you want to add anything?
I'm trying not to.
Okay. Yeah.
Only because, Georgia did not expand Medicaid. So we know the fight as it relates to access to healthcare. Moving forward in 2024, Georgia Governor Kemp did design the Georgia Access Program, which is designed for assisting people with getting on health insurance. So one of the ways that we are making sure that the people that we serve are at the table is that we have to be at the table. So we have to be there, even if the expansion of Medicaid, which may have been a larger goal, if that wasn't accomplished, we still have to be at the table with what was accomplished. And so with the Georgia Access Program, we are making sure, as a collaboration, that federally qualified health centers are at the table through the Georgia Primary Care Association. We as FQHCs, will have licensed navigators in addition to certified application counselors in the Georgia Access Program, so that if our concern, which it is that underserved communities will still not have information about how to enroll in Medicaid, Medicare, and Peach Care for Kids, we are there. We'll be at the table to make sure that the patient base and the community base that we serve know that those programs exist in addition to the private insurance programs. And so I think it's important that when we're doing our advocacy work, that we may not win on a level that we were going after, but we cannot remove ourselves from being at the table. We can't decide this is not what we wanted, so therefore we're not going to participate. It's the same thing that happens when people, when the election results is not what people wanted it to be. So now you're going to just take yourself out of the process, and you're not going to hold the person that was elected accountable. We can't take that stance. It may not have been your candidate, but you've got to stay involved in the political process to make sure that the candidate, that the office that was filled, whoever that was, that you still hold them accountable for what it is that you would like to see. That's community power. You don't walk away when you don't feel it was your win. You got to stay involved and got to stay at the table.
Thank you all so much. I think Parisa's comment, I completely agree with what you put in the chat, and we see that a lot here. Like, well, why wouldn't you want to stop trafficking, or, or these other things? And it's like, well, you have to dig a little bit deeper. And I think, Erica, also your comment around, like, how do we keep people engaged when things are really emotional and heated and people want to engage and take action then, but then they kind of like pull away when it's not an immediate threat. And that's when we really need people the most. And so I think that's something that I know our organization is trying to figure out as well. So I feel that. So moving on to our next question, we see over and over again how terms can become buzzwords, and we're hearing a lot about community engagement and power building. What needs to be in place or considered to ensure authenticity? And what innovative ideas or strategies are you seeing that are successfully building power? And Parisa, I'll start with you.
Sure. I think it's all about accountability. You can say the right thing, but to say something and do something are quite different. So our commission is working on a set of recommendations that would move towards dismantling structural racism in state government. So we're looking at things like hiring, contracting and procurement, and internal operations, which can also include things like what kinds of data do you collect? How do you analyze that data? How do you look for if people are able to access things, if people are running into language barriers or even technical barriers? And one of the conversations I had with, we've been talking with state agencies and seeing, what practices are you already doing? Because it's always good to have an understanding of, what's happening at the federal level, what's already happening in your state or your sister states. And so what can you kind of sell that way of, look at what's been working, we can expand this, we can scale up this effort. And a deputy commissioner who's been doing some really great work and really is a champion, I think, in Connecticut for dismantling racism in government, said to me, it has to be somebody's expectation that these things will happen. So speaking to the need of leadership buy-in, the change makers, the people that hold the power, the people that everyone reports to, they need to have an expectation that you're going to change some of your hiring practices, that you're going to look at who you contract with and how you set up your contracts, and if you keep rebidding to the same people. Speaking very much around kind of government operations right now, but it also is to say, how do you do your policy analysis? Who do you listen to? And if we can set up equity plans and be very specific, the same way that you would when you're doing a policy advocacy campaign and you have a work plan, you have something that is, a few sheets long, maybe it's a detailed even spreadsheet or table where you're saying, who do I talk to? Who do I listen to? Who's at the table? How do I disseminate information? How do I collect information? Am I designing a policy that's actually going to solve the problem that we're talking about? And am I making sure that we're going to implement it correctly? Thinking through kind of like the process and outcome measures for your work. And I think this is something where like government can learn from advocates, because a lot of you do this type of work. But I think that is what it is. I think it's about accountability, especially we should ask that of our leaders and of our people that hold decision-making power, while we're also seeking to change and diversify who has decision-making power. But a part of that is making sure that someone is held to account, and it has to be someone who has power right now needs to have an expectation that we're going to change things.
Definitely agree. I would say that on a community perspective, to add to that, because I think that's absolutely right when you're talking about accountability for legislators and the people in power, where they're like all about like these buzzwords, the health equity. Yes, we want health equity, but we can't challenge policy. No, because we've always done it that way. That's one thing, but also community itself, it's organizations. If you say that you want to work with community, if you want to say you want to be grassroots, if you say that you want to be co-designing, then you need to be willing to invest in what you need to do to actually work with your community, and not just parts of it, but all of your community. That means language access. That means cultural humility. That means investing in leadership training for your community, so that then they're the ones that are leading the campaigns and the advocacy projects, and it's not you and what you want because it's going to make you feel better. But it's really what the community wants. So you have to be willing to put in that work, that really hard work of empowering them, training them, giving them those spaces, making sure that they have access to all the same things that you would need to be able to do those things. And of course, pay for their time and talents. And then that's working with community. That's how you make it real and authentic.
I mean, the only thing I'll add, because I feel like I was going to say a lot of what folks have already vocalized, but I think that I think it's not really possible, I think, to explain the ways in which marginalized and disproportionately impacted people experience, harmful policies and practices, or experience disrupt to our care, if we don't really think about things in systems. And so I think it's really hard to see any progress on our issues without tying them to economic inequity, and blocking services through telehealth in North Carolina is tied to disability justice. And when criminal implications, lie ahead of our providers and the doctors who we trust. So if we really want to break, barriers to accessing care, and if we really want to serve as trusted messengers in our communities, we have to be willing to see that, that the ways in which access goes well beyond legality, I think.
Yes, we say that a lot at my organization. Legality does not equal access for our people. And when we're talking about bringing in people, we need to talk about paying them, childcare, food, meeting at a time when community can meet. I think we're seeing that a lot in Colorado. A lot of organizations are doing policy now where they have a steering committee of folks with lived experience, and they're actually making policy decisions like, hey, the sponsor or so-and-so wants to change the bill to say this, like, bring it back to the people and what do they say? And it's actually a lot harder to, say no to the people than it is to like policy advocates like myself. And so I think that's a really good strategy that we're seeing be really effective here in our state. Okay, so we have one last question. I'll ask you all to keep it to about a minute or so we can save room for questions here at the end. But I think we all know that this work can be hard and draining, and it can feel like we're always on to the next fight or battle before we really stop to take a moment and appreciate what we have been able to accomplish. So can you please tell us about a win that you have seen or had recently that was a reason for you to celebrate? And whoever wants to kick it off.
I can go. I have one that I can think of. I think it is important to also make the work itself as fun, if possible, as you can, just because it is draining work and you're talking about all these horrible things. So when we have our coalition meetings and our task force meetings, make them social events and make people want to go and get to know each other and what's going on. But a small one that I can talk about, going back to one of the things that I mentioned earlier in one of my responses, was how in our county, because of that HB 2350, some of the initiatives that the county was going to be putting forth had been blocked or paused. And so after the last commission meeting, when they decided to kind of indefinitely pause the IDs, the municipal IDs, the community, the coalition responded in force that was not okay. That's not what we wanted. We reached out to commissioners and we got a meeting with the mayor for next week. So, I mean, it's a small win. We don't know if that's going to overturn what they decided, but we're hopeful that they're willing to have the conversation and that he's given us time to go and talk to him about why it is that we don't agree with him. And to not make decisions based on trying to defend us when we can defend ourselves from anything that happens from the, Secretary of State, if that should be it. But yeah, so we're excited about that.
I can share really quickly. I think that when it comes to Muslim lived experiences, and the intersections of that and health justice, and particularly reproductive justice spaces, we're not always at the center of decision-making power or visioning of what these spaces look like, and the visioning around community power building in our communities. And one of the things that I'm really celebrating is that the ways in which Muslim Women for has really served as key partners in these coalition spaces, to bring our, the realities of our lived experiences as Muslim people in North Carolina and in the South, and be able to actually like create a pipeline from that kind of power building and visioning space to the ground and to our people, to be able to orient these policy fights to our people in ways that I don't think they've experienced before in our state. And I think that that's a challenge that maybe a lot of folks on this call sit with, and depending on what identities and communities they carry. And so that is something that I'm celebrating. Like, this is where we are right now, where I feel like that wasn't really possible 10 years ago when I started as a student organizer. And it's just today our ecosystem of organizations in North Carolina put together a call to really hold what we're experiencing in this moment. And that was really beautiful. As we think about the fight ahead in 2024 and beyond, being present in this moment. And again, I don't think that that's where we were 10 years ago. So there are shifts that are happening that are really beautiful, that I'm really celebrating today. And I've been feeling really broken and defeated over the past 10 days. But that really gave me some hope and some recharge. So celebrating that.
I would share that for me, doing this work every day, the celebrations are daily. For me, we are physically housed. The corporate office is physically housed inside of the medical center. And so for me to go downstairs every day and to see our patients, to see them actually having access to care, to see them registering to vote, gathering information in our center that is beyond the healthcare setting, but understanding their doctor as a trusted source to actually, pick up the information. Those are wins for me. I don't leave my office on any given day that I didn't win. We won every day. And I tell our team that, the outreach team that is out in the field and feeling beat up and hearing people at a discouraged space, et cetera. I tell them all the time that we win every time someone comes through our doors for services. And then quickly, I will add the other win for me is this forum. For me to be a part of a forum where the interest of the Latino community and, Hispanic first, the interests of our Muslim community and others of color and disadvantages have joined the voice of the African-American Black community that has been talking for centuries about the disparities for us in this country. And to have other people saying it's systematic, it's this, it's that. We're like, that's what we've been saying. It's not that I had a lazy grandmother. My grandmother worked like a slave because she was, and so to hear other voices at this table saying we've got to be a catalyst that works together to empower the entire community, and that it covers a larger spectrum of that is any group of people that are being oppressed and their voices are being suppressed. The need for the work to be done is on the table. And I love it. It's a win. It's a win.
Carissa, you want to close us out?
Sure, although that was so beautiful. I want to put a pin. Thank you so much for that, Marguerite. I think we've heard it already, but I just want to say not all wins come in the form of a law. And so I think that's so beautiful that doing the work is important, having a conversation, getting further than you were before, that momentum, it's all part of it. And we'll burn ourselves out if we don't enjoy the progress. I do want to call out some things that keep me going are like the wins as they go. I have this, ultimate vision, and I'm fortunate to work for an office that we hope that one day your race, ethnicity, zip code does not dictate what your health outcomes or so inform what your health outcomes will be. And we know that there are two very different Connecticut's based on race, ethnicity, and money, and those things are linked to money and race. Because just like Marguerite said, her grandmother was not lazy. And white supremacy was the justification for stealing labor and creating the big economic divide that we have on the lines of race. I never want those things to be separated the way that we tend to separate them, but I'm rambling now. I just want to shout out some wins that really fortified me this year. The Connecticut Oral Health Initiative, which is the organization I was formerly at, so my successor, and a bunch of other advocates and good folks at the state worked together and got periodontal coverage in our dental benefit, which is a huge deal. A lot of people have other sorts of health problems, diabetes, whatever, that's really hampered by not having that gum disease treatment. Husky for Immigrants, I know Rose Ferrero's on here. She's a big part of that coalition that's been working to get a Medicaid lookalike program for undocumented immigrants and other immigrants that are income eligible, but not eligible for Medicaid. So they keep coming at it every year, and of course wanting it regardless of age, but every year they get a little bit further. So we got it up to age 15 this year. It's amazing work. And we now have a plan to have community health workers reimbursed through Medicaid, thanks to a whole group of advocates, but Health Equity Solutions really kind of championing and taking the lead there. And that kind of work, being part of it in any way, being around it, watching those advocates do their thing and get these wins, make this progress, even if it's not everything that they wanted, but making amazing strides, that nourishes me and keeps me going.
Thank you all so much. I want to clap for everybody. I think, yeah, right. It's just an onslaught of like bad things, I feel like, on the news and when you scroll, but like there is such incredible work being done in community to really shift power, to move us more towards health, justice, and equity. And again, like I'm just so honored to have facilitated you all and been part of this conversation. We have about 5 minutes. I know I promised y'all 10 to 15. We don't have that. We have 5. So if anyone has a question, you can drop it in the chat. We can answer it. Or if you want to come off mute, I think you're able to do that as well. Now's your time.
Hi, this is Rose from Connecticut that Parisa just referenced, but what I want to say actually is not only are we fortunate to have Parisa in Connecticut, but we're fortunate to have somebody in state government that has stood shoulder to shoulder with folks. And I think there's something to be said about not forgetting that like part of what the work is getting folks like Parisa and the rest of y'all in positions where you're able to facilitate that kind of work. A good example I'll give is that, Parisa lifted up the Husky for Immigrants, recently had a report done, and she lifted us up and had us present at a commission meeting, for example. So those kinds of allies and co-conspirators are invaluable. And those folks that, shift from advocacy, organizing into roles like government and in other positions, I think part of our responsibility is to keep those folks in and to try to get, folks that are not with us out. So I just want to, be, sort of appreciate the lifting up, but I would also say that Husky for Immigrants is immigrant-led and immigrant-centered, and we work really hard at that. And it's always a team thing, right? Everybody has a role. And I really appreciate Parisa's role and all the other Connecticut advocates and organizers that do the work they do.
I'll just pop off mute to say that we also appreciate the work of Connecticut. Color just passed a bill this year that was modeled after a Connecticut bill, and you all were the first in the country to do it, and now we're the second, and we added a little piece to it. But Connecticut advocates, I think, are really, everyone's really out there doing the work, but it's so nice to be connected. Anyone else have questions? Angie, I just saw you come off mute. I think in the meantime, if any of the panelists want to share, like if anyone wants to follow your organization, any action alerts, how they can get involved, maybe drop that in the chat. I will also drop my email in the chat. But there's a lot of good work to support here, so please put whatever you want in there. No questions? Okay. Well, in that case, then I will close us out. Thank you all again so much for participating and engaging with us in this conversation on how to build power within our communities and work towards health justice for all. I dropped my email in the chat if anyone else wants to do that as well to keep in touch with us. And I am now going to pass it back to Trey Manisha, who's going to share a few updates and close out this year's Community Catalyst annual convening. Thank you all so much.
Thank you, Catherine. Thank you for this phenomenal panel. And before you all go, I do have a couple of words I would like to share with everyone. And then we have some announcements at the end. So please don't log off too soon. So I was thinking about how to close out this year, and I was thinking of all the phenomenal panels that took place and possibly connecting the themes or the key words and phrases that were said that really felt impactful throughout this convening. And how full I feel at this moment. And what came to me and what stuck with me was the word more. More. And so I really want to talk with you all just a second about what does more mean, right? And for me, it was like, what are we all committed to doing more of? Because we go to convenings all the time, right? Like, what are we all going to leave this convening saying, I'm committed to do more of this? And then on the opposite side, what are we all committed and individually committed to doing less of or stopping altogether because it's not working, right? Because one of the things I've learned from this time together is things have to change and shift. And it starts with us individually. If we're going to build power, it's an individual, and then it goes and grows to a collective thing. So I really want to push people to think through that. And in the same token, who are we committed to connecting to? Maybe there were bridges that were once burned that we need to kind of rebuild. Or maybe there are folks that are fighting on the other side of the aisle and we realize that, you know what, hey, there are things we actually have in common and we need to at least meet and come together around that common ground. I think that's really, really important. I also want us to think about ourselves and what does it mean to hold ourselves accountable to this growth that we see, that we envision, the movement that we are fighting for day in and day out. And what does it mean for us to hold our organizations accountable to this movement and the people that we say that we're working with, because we can't do this for them, right? We went over and over that throughout the convening, but the people that we're fighting with and fighting alongside, how are we going to be accountable to our role individually and collectively within this movement? So I just want all of us to kind of think about that. What's your more? And what is it that you need to stop? Because if we're going to grow as a movement to counter all of the attacks that we have been faced with, and it's getting heavy for all of us to try to hold it, it's getting burdensome for us to deal with it individually, we have to break down the silos in order to do it. And we have to think about our collective growth. Our movement requires collective growth. Our movement requires accountability to ourselves, accountability to our communities. And we can't do this for them. We have to do this with them. And so I thank all of the panelists. I thank all of the speakers, all of the presenters, all of the support staff. Special thank you to Collaborative Communications for your support. The community convening planning team that worked with us, thank you so much. We had 16 organizations agree to join a community convening planning team. This convening was so beautiful this year because of all of you. And so we thank you for all of that. We thank all of the performers everyone that came out. We had over 600 people registered this year, which is phenomenal. So we thank each and every one of you for all that you do. A special thanks to Community Catalyst, our phenomenal leader, our executive director, Emily Stewart, for having a vision to bring us all together and staying with us. So we greatly appreciate you for that as well. And so before we leave, there's a couple of announcements we have to make. So please don't log off yet. First and foremost, Barbara's going to drop the survey, the final big survey in the chat box. So please complete the survey. Next thing, we want you all to use the hashtag. Please, if there's something that you glean and you learn that you're going to use in your work, share it. We want to share it with our community. So please use the hashtag. The hashtag is also going to go in the chat right now. The other thing is everyone that registered is going to get a gift from Snack Magic, but you got to claim it. So please look at your emails, look for your Snack Magic gift. Go online, claim it. If you have some gift bags, that they're phenomenal. The treats are phenomenal in the gift. That's one of the highlights of the convenience. So please claim your Snack Magic gifts. And then the next thing is I want us all to come when we come back in December, because our next convening, the save the date is going to go on the screen right now. The save the date for December 2024. When we come back together, we should be able to say, you know what, we did more of this and we stopped doing that. And now we're a much stronger movement because we're working together and we're united. And we're breaking down barriers together. So we're not getting burned out individually. So I really would love to see you all 2024 annual convening. We're looking to touch down in Atlanta, Georgia from December 3rd to December 6th. So please save the date. And now, without further ado, the moment you all have been waiting for, because I know you're tired of hearing my voice, we have DJ Albie 360 that's gonna give us some beautiful sound. So please stick around, celebrate the convening, celebrate the work that you've done this year. Relax. I think music is therapy. So definitely join us in chair dancing or however you want to do it. If you got the kids in the background, it's okay. Bring them out. Now we're going to turn it over to DJ Albie 360 to kind of take us away. So thank you all.